oftentimes we can just increase the sensitivity on the ventilator, and then it will help support the patient more fully and stop alarming that the patient is apneic. Is there a leak in the tubing? We talked about if the patient's connected, if the sensitivity is fine, and if the patient seems to be triggering breaths, where is the air going to? Is it possible that the air is not going through the circuit, so the machine is sensing that the patient is apneic when actually they're not? They're just not getting adequate support because there's a leak somewhere. Simply change out the tubing that has the leak in it to fix that. And again, if all else fails, we need to depend on our respiratory therapist to come help us out at the bedside. The next slide shows some of the things we can look at, again, with looking at the scalars to give us an insight into what's going on with our patients. The first one shows sensitivity. You can see the pressure drops below the baseline because the patient is trying to trigger a breath. That's the negative pressure we all generate before we take a breath. If you see this negative drop below the baseline happening and the machine is not sensing it or giving the patient a breath, that's when you're going to see an apnea alarm happening with the patient. The next slide, the next picture B on the same line for sensitivity shows the same thing. There's a negative pressure drop where the patient is taking a breath but not necessarily getting that breath from the ventilator because it's not sensing it. The next one down, air leaks. It can show you the exhaled volume does not reach the baseline, which means where's that air going? The circuit's not sensing that it's getting all of the exhaled volume that the patient should be giving out, which tells you that the air is going around the circuit and the vent is consuming that volume because of a leak. So that's a good picture to look at to know when your patient has a leak going on that could be causing an apnea alarm. And everybody's favorite part of a lecture, I know it's mine, is doing a little bit of a case study to teach us to put all the stuff that we just learned into